Assalamualaikum warahmatullahi wabarakatuh. Today, on behalf of my colleagues, I would like to present our research about strategy for implementation of school child immunization month program in COVID-19 pandemic at Batujajar Health Center. COVID-19 pandemic is known to have interfered with many programs in the health sector. One of the effective programs is the School Child Immunization Month or BIAS program. The immunization program must still be completed according to its schedule to protect children from the immunization preventable diseases. The postponement in the implementation of the BIAS program during the COVID-19 pandemic was due to the execution of online learning in the students' homes starting from May 2020, stipulated by the Ministry of Education and Culture of the Republic of Indonesia in order to prevent the transmission of COVID-19. Referring to data from the Health Center Performance Assessments or PKP, we can see in data 2019, the BIAS program almost fulfilled the set target of 95%. But in the PKP 2020, the BIAS program did not meet the set target of 95%. As we can see, the DT, TD, and measles BIAS program was below 95%. The present implementation of the BIAS program may be different from the previous one, as there is a need to follow the health protocols to prevent the transmission of COVID-19 for both officers and immunization target. Based on this, the researchers intended to know the strategy required for implementing the BIAS program during the COVID-19 pandemic. This research used a qualitative method by conducting in-depth interview with the coordinator of the immunization program, the head of community health center, the coordinator of surveillance, the coordinator of the health effort, and the principals and also the parents of the students. The data of informant was done by the purposive sampling and the data was analyzed by descriptive. Other instruments are informed consent sheets, tape recorders, audio and visual recording, transcripts of audio recordings, and interviewers' notes. The implementation of BIAS during pandemic at Batujajar Health Center could not be implemented as it was scheduled. The immunization was only administered in safe zones, and the cross-program and cross-sector collaboration was implemented at Batujajar Health Center during the implementation of BIAS. The cross-sector collaboration included collaboration with school supervisors in Batujajar district, schools, and villages related. Cross-sectoral collaboration was also made with the West Bandung Sub-District Health Office and Batujajar District COVID-19 task force. The community collaboration established was a collaboration with the parents and teachers. Socialization was distributed from the community health center to schools by WhatsApp application, and school used WhatsApp application to deliver the socialization to parents, then recorded the students to immunize and chose places fulfilling health protocols. The implementation of the BIAS program during the COVID-19 pandemic at Batujajar Health Center were following health protocols, arranging places for immunization, providing hand washing facilities, soap or hand sanitizers, wearing PPE, setting a safe distance in 1 until 2 meters, regulating the flow of entry and exit, division of the arrival of students into several sessions, and arranging the previous implementation possible of each session and for the parents waiting outside the vaccination room. The immunization program coordinated through field officers reporting was to monitor the implementation of BIAS program. Problems occurring in BIAS programs are schools' difficulty applying health protocols during the administration, some parents' resistance to children's immunization, misinformation that it was a vaccine for COVID-19 or the vaccine was expired and also the children were sick or afraid of the sirens. For these problems, better socialization and coordination on the implementation of this program was needed. And this is the end of my slides. Thank you very much.